What if the thing wrecking your gut health had nothing to do with your diet? My guest today is Dr. Kate Davis. She's a chiropractor and functional medicine doctor. She spent nearly a decade suffering from a whole bunch of things that stemmed from chronic gut issues, but then she discovered she had a massive parasite infection. And I said massive. She's going to tell you what that means, why parasites are more common than you think, and most importantly, what you should do before you ever touch a parasite cleanse. Welcome to the Health with Hashimoto's podcast. This is where you will find clarity and simple, sustainable strategies to feel better. I want to help you figure out your root causes. My name is Esther Youngkin. I am a registered nurse. I know how exhausting it is to live with fatigue, brain fog, and the ups and downs of Hashimoto's. And that is why I'm here. I'm here to cut through the confusion and to give you practical steps that support your body, calm your immune system, so that you can regain your energy and feel like yourself again. Dr. Kate Davis is a licensed chiropractor and functional medicine doctor who personally battled chronic gut issues for nearly a decade, only to find out that she had a massive parasite infection. Leveraging her healing journey, she has since helped hundreds of women to overcome chronic gut conditions from constipation and bloating to IBS and acid reflux. Dr. Kate, welcome. I've talked a lot about gut health on the Health with Hashimoto's podcast because it's a huge root cause. So tell us your story and a little bit about why gut health matters.
Yeah, well, thank you so much for having me on here, Esther. It's definitely excited to be on this one. I love, talking to other, Christian podcast hosts who are doing good in the world and really helping people. So, yeah, I really started, back in my 20s. I was 24, had horrible gut issues. I mean, it came out of nowhere. And I was a vision of health, right? I was a former D1 athlete. I didn't look unhealthy. I took care of myself. Maybe I didn't have the best diet at the time because I was one of those skinny fat people, where like you eat everything and you never gain weight. But it was, for the most part, like I was active, I exercised all the time. It didn't make any sense. And I was in so much pain. I actually went 13 days without a single bowel movement. I had really severe constipation. And I was on Miralax for 11 of those days and it did nothing. And so I was in a lot of pain, couldn't even sit up straight in class because my stomach was so bloated and I couldn't eat more than a small amount of food at a time. Like it was really uncomfortable, really painful. And I did what everyone does. I went to a GI doctor and they did some testing. They diagnosed me with gastroparesis, which is kind of a useless diagnosis, like a lot of them are, where it just means stomach paralysis, if you break down the Latin root word. And it just means you're not moving food from your stomach into your small intestines in a reasonable amount of time because your body can't digest the food. And so all he offered me was two terrible options. He was like, number one, we can give you a drug that you have to take the rest of your life. But one of the common side effects of this drug is permanent facial twitches. And I was like, I'm 24 and single. I'm going to say no. Do you have any other options? Like, I'm not taking that drug. And he's like, well, we can remove your intestines. And I was like, okay, I'm going to go see someone else. And never went back to that doctor. I was like, that's insane. Like, those are your only two options was drugs or surgery to remove like a really important organ in the body. And so after that, I was just, I went back to school. I asked around. I was like, hey, do you guys know anyone who can help with gut issues naturally? Because I haven't been able to go to the bathroom in like 2 weeks. And they referred me to this doctor who luckily had an opening the next day, which was awesome. Like he had a cancellation, which he never had because he was always really booked up. But he was a chiropractor who had a background in massage therapy before he went to chiropractic school. He was a functional neurologist. I don't know if you know anything about that, but he did this myofascial release in my abdomen, which for those of you who've ever had myofascial release, it doesn't feel like anything. It's very gentle, just moving around that layer of tissue that surrounds your muscles, your skin, your organs. And he did some organ manipulation. And I remember leaving thinking to myself, what the heck did I just pay for? Because I didn't know what he was doing. He's just like doing very gentle release. And I was like, okay, I hope I feel better. I had like 4 or 5 bowel movements that night, which was crazy.
Wow.
And I swear I lost like 5 to 10 pounds because I was just so backed up. And I felt so amazing. It was such a relief to be able to go to the bathroom again. And he was actually the first person who said, maybe you have parasites, but I just didn't listen because the stool test was negative. So I actually did order one of those tests, but I completely overhauled my diet, went paleo, gluten-free, dairy-free for about a decade. And as long as I stuck to that really restrictive diet, I felt okay. But anytime I strayed off of it, all my symptoms would come back. And so even though I had avoided a lot of the symptoms, I never really feel fully healed until my friend was in town. because all my symptoms had come back even on the clean diet because of a stressful life event. So I know you talk about that a lot on your podcast about stress and how it triggers a lot of these health issues. But yeah, I had a really, really bad, car accident and all these symptoms came back and they were worse than they were before. And I was on the verge of an autoimmune disease. I was getting swelling in certain joints. Fatigue was really bad and never had energy issues my whole life. And I was just, a mess. And she did some testing, found a massive parasite infection and a lot of other issues like leaky gut, gallbladder dysfunction. And she put me on a, really specific detox plan. And after being on that detox plan for, about a month and a half, I passed a 3-foot long parasite. It was gigantic, like massive. And I was
Oh
I was
my
blown
goodness.
away. I was like, where was this living in my body? Because it was thick. It was like a centimeter wide, like half a centimeter thick. Like it was disgusting. But after that, I started pooping on my own 2 to 3 times a day. Like consistently, I passed hundreds of other parasites that were smaller, all different shapes and sizes. I mean, I had so many different parasites in my body that at one point I just called her and I was like, am I like half human, half worm? Because they keep coming out and it's been like 4 or 5 months. She's like, oh yeah, you were just super infested. So yeah, they'll probably keep coming out for a little bit longer.
Oh my
But
goodness.
all of my health issues went away. I mean, the swelling went away, the bloating, the acid reflux, the constipation was completely gone. I could eat dairy and gluten again, which I didn't even think was possible. I just thought once you have a sensitivity, it just never goes away. And I just felt like a new person. And so I started treating all my chiropractic patients. They started getting phenomenal results. And, ever since then, I've been able to help, hundreds of women really resolve, bloating, constipation, acid reflux, IBS, all those chronic gut issues.
Wow. A 3-foot long worm? That's so gross.
It was
Like,
really disgusting. Yeah, and I was curious, so I had, like,
yeah.
gloves, I had, like, a long
Oh, yeah.
Q-tip because I was like, "I'm gonna find these suckers because I wanna see them come out so that I'm justified in all the pain I went through." And yeah, no, I tore it open, it was hollow on the inside, I was like, "This is not mucus," because a lot of people will be like, "Oh, it's a mucoid plaque," and I'm like, "No, that was a legit worm."
Wow.
It was
So
yeah,
where do
it
you
was
think you got that many parasites? How did you get infested?
I don't know because I'm sure you learned this in nursing school, but in America, they always teach you, oh, it's okay. Parasites only exist in third world countries, which is total garbage. I've seen a lot of people who've actually never left the United States who have parasites come out when we're detoxing. So they are in the United States. Now, granted, they're not as severe and they're not as common as other countries like Southeast Asia and Africa, but they do still exist here. And it's not so much being exposed to the parasites that causes the issue. It's a reflection of your internal environment and your immune system's ability to fight it off that really determines whether or not you're going to get infected. And so for me, I think I got some of them from my mom because some of them can actually pass through the placenta while you're pregnant. I don't know if people know that, but let's always recommend trying to detox before you get pregnant. Otherwise, you could pass those suckers on to your kids.
Yeah.
And I'd also been to a lot of different countries. By the time I was 18, I'd been to at least maybe like 6 different countries at that point, and a lot of them were in the Caribbean, like, maybe not the cleanest water and food in that area, and I was born in Europe as well, so it's hard to say where I picked them up. I never ate fish as a kid, I always hated seafood, so I think that probably saved me from getting, more gut issues sooner in life,
Yes.
but yeah, I don't know where I picked them up. They're so common and they're everywhere, and it's not to be afraid of them, right? It's if you have a good immune function, if you're producing enough stomach acid, if your gallbladder is working and producing enough bile salts, you should eliminate those parasites as soon as they enter your system from food and water. But it's when those organ systems break down, it's when your immune system breaks down, that's when they become really detrimental to your health. And that's when they can really start to overgrow and start taking over. Because I'd had gut issues since I was in my teens, like I just ignored it because it's, you're a kid, you're eating garbage for food and candy and cereal. And
Yes.
especially if you grew up in the 90s, you're eating a lot of cereal for breakfast. So, not the best diet to really promote good immune system function. So, I think a lot of it was definitely self inflicted, but I also had a really severe head injury when I was 18 too. And that's a huge trigger for a lot of gut issues in people. And because your brain communicates with your immune system, it can also mess up immune function as well.
Right. So if somebody's listening, they have Hashimoto's, so they
Mhm.
know their immune system is not optimal, and Hashimoto's is always linked to a gut issue. If
Mhm.
they're listening, they're like, "Oh my goodness, Dr. Kate, maybe I have a parasite." What do they do next? Do they just like get the next parasite cleanse that comes across their Instagram feed because there's a lot of them?
No. That's such a good question because it's such a popular thing nowadays. Like everyone is talking about, oh, I need to do a parasite cleanse. And I'll just ask them, I'm like, have you done any testing to see if you even have parasites? Because maybe you don't have parasites. Maybe you have mold toxicity or heavy metals or a really poorly functioning liver. And that's creating a lot of digestion and, hormone issues in your body. And so it really depends on the person. I never recommend starting with any supplement, any detox. Like, number one is you've got to get some testing done to know what you're targeting because otherwise you're just throwing spaghetti at the wall and hoping it sticks. And also, if your body's not ready for detox, if you have really poor drainage in your body, you can't get toxins out efficiently, or you have leaky gut, which, we all know that autoimmunity starts in the gut with leaky gut. If you have leaky gut that's been prevalent for a long period of time and you haven't focused on healing it at all, when you start dumping a bunch of those toxins and pulling them out of your tissues, a lot of them are going to recirculate back to your bloodstream and put a lot of stress on your liver, and that can create a whole host of detox reactions for people. So you really got to be careful. You got to know, like, hey, we've got to really focus on healing up the gut lining. We've got to focus on supporting gallbladder, liver function, because those are your three main organs that remove toxins and waste products from your body. And then also 80% of your immune system lives in the gut. So you've really got to focus on, with any autoimmunity, you got to start with gut health because it all starts there. Like, there's so much research showing leaky gut is the precursor to autoimmunity. And I've seen that in a few of the Hashimoto's patients I've worked with, where once we start healing their gut, you'll even see like those autoimmune antibody numbers on their blood work start to go down or even go back into regular normal levels. And they're like, wait, I didn't think that could happen. And I'm like, yeah, well, we healed the root cause. That's why your numbers went back to normal. But you still have to maintain this and not just go put a bunch of garbage food into your body. We still got to manage stress, manage sleep, all that stuff, all the basic lifestyle things as well. Because, just because you get out of that range doesn't mean you can't go back into it. And so it's really just knowing that even when the symptoms are gone, there's still a lot more healing work that needs to be done because that leaky gut didn't pop up overnight. It took decades to get there. So sometimes it might take a few years to fully heal. And that was the case for me. Like, even though all my symptoms went away after 4 months, my leaky gut was still popping up on testing for about a year and a half after that. And so I really had to just focus on, okay, continue healing the gut, continue focusing on all this stuff. So testing is number one. If you're going to do any sort of detox, you've got to know what you're going after because you're either going to go after the wrong thing or you're not going to pick up on drainage issues and then you're going to get a horrible detox reaction. So, getting full testing done, blood work, getting something done to check for infections, toxins, organ function is really going to be the best place to start.
Right. And how does somebody know if their leaky gut is healed and if their detox pathways are open? You said both of those things before you do a parasite cleanse or any kind of detox. But how do they know those two things are ready?
Yeah. Well, there's a lot of symptoms that can kind of tell you that. So obviously I go off symptoms plus labs because we know labs are not infallible. They do make mistakes sometimes. So we kind of have to do our best detective work with both. But signs of gut, any sort of gut issue, bloating, diarrhea, constipation, acid reflux, there's probably something going on with your liver and your gallbladder and your gut. So you got to make sure that we fix those issues first. In terms of testing, you can do, gut zoomer test is amazing, and they'll show zonulin levels. That's probably one of the best tests for leaky gut because when that gut lining breaks down, you release this protein called zonulin that's found in extremely high amounts in people with autoimmune disease. So if you're seeing that zonulin level continuously go down on stool testing, that's usually a good indicator. I know there's other ways to test it as well. And then, but any sort of testing that's just going to show leaky gut or gut dysfunction, there's a lot of tests out there now. One of my favorite ones is a hair follicle test that can actually pick up on pretty much all this stuff in one test. It's not as specific as gut zoomer or total tox burden testing, but it really does show you a full picture of, do you have gallbladder issues popping up? Do you have liver dysfunction? Do you have leaky gut, nutrient deficiencies? All this stuff that can tell you a lot about organs because a lot of your nutrients can also tell you if you have gallbladder or liver issues, depending on which ones you're deficient in. So yeah, that's probably the best place to start is just looking at testing, but also looking at symptoms. And constipation, the biggest gallbladder symptom I see with people is constipation issues because that helps stimulate that peristalsis motion in people. And I've also seen a lot of people who don't have their gallbladder anymore and they have Hashimoto's and they didn't realize the connection between gallbladder function and thyroid function. They're very interconnected. So there's a lot of different things to look at. For liver, I usually see a lot of skin issues with liver dysfunction. And then hormone issues, obviously, because that's where a lot of the hormones are, recycled and broken down every day.
Everything's connected.
Yeah. Yeah. You can't divide the body. It's not possible. Gut issues a lot of times are liver and gallbladder issues. It's not actually the gut. Or there's sometimes brain issues. You had a head injury that never got healed. You never went to anyone to actually, work on balancing the brain back out to restore that brain gut connection. It could be, insulin resistance. Like, especially because you work with Hashimoto's, thyroid hormones are one of the downstream hormones, but the master controllers of those hormones are insulin and cortisol. So if you don't manage stress, if you don't get your insulin and your metabolic health under control, your thyroid numbers are never going to go down. So it's really looking at the whole picture, right? Like when someone comes to me, yes, they're coming for gut issues, but I'm still going to look at metabolic health. I'm still going to look at thyroid function if I think that's an issue based on their symptoms that they're telling me. I'm still going to look at HSCRP, total inflammation in the body, see if there's maybe some other issue going on. And I want to see those numbers go down and get back into normal ranges as we're going through the detox to make sure we're on the right path.
Right. So if somebody's listening, they're like, okay, she just listed like 7 different things that I need to work on. Like,
Yeah.
what is the first thing? If somebody's listening, they can't do testing today, but they're
Yeah.
listening to you. They're like, okay, I clearly need to work on something. What's
Mhm.
something that she can do today or tomorrow to start feeling better?
Yeah. Can I give you 2 things?
Yeah.
Okay, cool. Stress reduction is number 1. So, the easiest way to calm down your nervous system at a physiological level, regardless of what's going on in your external environment, you can be in a season of crazy stress and you can still physiologically get your body back into that rest and digest, that parasympathetic state, is breathing. There's so many breath work exercises out there. One of my favorite ones is box breathing, but doing an exhalation focus where basically normal box breathing is you breathe in for 4 seconds, you hold for 4, you breathe out for 4, you hold for 4. I like to breathe out for 8, so twice as long as you breathe in, because exhalation focused breathing has been shown to actually activate that parasympathetic nervous system a lot more. It actually allows, better dilation of the blood vessels, better blood flow, better oxygenation so that, your body can heal and repair better as well. And so if you breathe in for 4, hold for 4, breathe out for 8, hold for 4, do that for 3 to 5 minutes. Honestly, if you're in a full-blown autoimmune state, probably 3 times a day. If you're just someone who just wants general good health benefits, once a day, is good. It's just good to start your day like that so that
Yeah.
regardless of the person who cuts you off in traffic or, the person who just irritates you throughout the day, your nervous system's already in a better state to where you're probably not gonna overreact and it's not gonna put you in that, sympathetic fight or flight. So that'd be number 1. And then number 2 is gonna be really focusing on sleep. I feel like people underestimate the power of good quality sleep, but, a lot of your hormones are produced at night, your liver detoxes at night, your brain detoxes at night. If you're trying to go to bed by 10, that's, like, ideal. Like, try to be asleep before 10 PM because your liver detoxes between 10 and 3 AM, somewhere around that time frame. And if you're not asleep in that area that time frame, you're kinda losing a lot of those detox abilities. And in terms of hormones, like Hashimoto's issues, your liver helps regulate a lot of hormones in your body. And so they all interconnect. We all know that. So it's just a great way to just reduce inflammation and just allow your body to fully heal. So like sleep and stress are probably the top 2 I would start with, and they're free. You don't need to buy any crazy biohacking machines or anything like that. You can do if you live in a nice area that's not snowing all the time, you can go outside and do grounding for like 20 minutes a day. It's really, really beneficial for inflammation in the body. So there's all these simple things you can start with, but those are my top 2.
That's awesome. And who do you work with? How can somebody work with you? Do they have to be in California, or tell me about that?
Yeah, so I work with people all over the world, actually. So I started working with people out of the country recently, which has been really fun because I didn't realize you could actually ship all these great labs, like the Gut Zoomer and the Total Tox Burden, like all the way to Europe and get the result, or Australia. And I was like, oh, I can actually work with people in those countries now. So yeah, I work with people all over the country, all over the world. The only restriction is New York because they pretty much don't allow any labs to go in there. So sorry if you're living in New York and you're wanting to work with me. I cannot, unfortunately. Talk to their government. It's not my fault. But yeah, I work typically with, women who are struggling with chronic gut issues. They've tried diet, they've tried supplements, nothing has fixed the issue yet. And a lot of times it's really just because they've got those chronic infections and toxins that nobody's ever addressed. And removing those safely is really like the last missing piece of the puzzle for them. So that's who I work with. And then in terms of how to find me, the best place would be Instagram. So I have a lot of free information on there. It's at Dr. Kate Davis. So DrKateDavis. And if you just go on there, just, hit that follow button, just look at all those videos I already have uploaded. It's a really great place to start. And if you're someone who hasn't even focused on the diet piece and want to start cleaning up your diet, I've got a little highlight reel called Trash or Treasure, where I go through like those healthy brands of food and tell you if they're actually good for you or if they're not. And I go through like the ingredients and tell you kind of what's good, what's bad. So it's a great place to start for somebody who's just wanting to clean up diet a little bit and actually get their health on the right track. Yeah, if you wanna work with me, just I do offer a discount for people who hear me on podcasts, so if you just DM me the number 100 on Instagram, I'll give you $100 off an initial consult plus labs package. So, if you're someone who's, really struggling, really wanting to get their gut health back on track and you haven't really found any solutions yet, I would definitely start there.
Awesome. And I'll have those links down in the show notes so everybody can just click over there. Dr. Kate, thank you. You have given us so much to think about. So if there's one thing, like somebody's a little overwhelmed, they're going to remember the stress and the sleep.
Yeah.
It's the biggest thing that you want them to remember about anything that we talked about in their health.
Yeah, I mean, number 1 is get testing done. Get, like, functional testing, not your yearly blood work, not, what the MD is gonna order, but get something done that's actually gonna show you the root cause, because I've seen so many people who have done, all the SIBO breath tests and, all those standard colonoscopy, everything's clear, nothing's showing up, and then we do functional testing and we find parasites and mold and heavy metals and, liver and gallbladder dysfunction that nobody's ever addressed. So, number 1 is work with someone who can get that functional medicine testing done for you, functional medicine doctor, an integrative MD, a nurse practitioner, somebody who can really just dig deeper and find out the root cause, because otherwise you're just going to waste a lot of time and money trying to fix yourself and you're not going to see the results that you want.
This podcast is for informational and educational purposes only. Please discuss any changes with your trusted healthcare provider. To take your next step, join our school community and explore the courses available there. You do not have to figure your health out alone. So that is school, SKOOL.com, and it is the Health with Hashimoto's community. I'll see you next time on the Health with Hashimoto's podcast.